Hello and welcome to another edition of Health Check, your trusted weekly guide to understanding the body, the science, and the stories that shape our well-being. Right here on Voice of the People Television. I am Shoma Lina, and as always, I'm delighted to be here with fresh energy and a deep commitment to unpacking health issues in ways that are real, relevant, and empowering. But first, remember you can also watch us live on SLTV channel 264 and follow us across all social media platforms at VOP TV Live. Today, we're discussing a topic that affects us all, both directly or indirectly. And what's that topic? Patient safety, with a special focus on protecting children and saving lives. You know, every year, I tell you, every year that counts, millions of patients, especially newborns and children, suffer preventable harms in hospitals and clinics, even at home, from medication errors to poor hygiene practices. These lapses in safety can have devastating consequences. So, this conversation, couldn't be more timely. Because just this week, the world observed World Patient Safety Day 2025 with the theme, Safe Care for Every Newborn and Every Child. It's an initiative of the World Health Organization dedicated to reducing avoidable harm in healthcare. And here in Nigeria, where child mortality remains a major concern, the message is clear. Patient safety is not optional. Is essential. So I'm going to repeat again that our topic today is patient safety. This year's theme is a timely reminder that healthcare must not only treat, but also protect, especially for our most vulnerable patients, our children. I'm going to repeat it again. Our topic for today is patient healthcare. And joining me to explore this deeply important subject is Dr. Charles Adiogu. Dr. Charles is a public health physician, wellness advocate, and someone who has spent more than a decade working at the intersection of healthcare delivery and patient right. Doctor, you're welcome to Health Check.
Thank you.
It's so good to have you.
Same here.
I look forward to today. Every time I'm having Doctor to, talk this over with, I'm always very excited, because you bring some in-depth insight into all of this. So, but let's dive straight into the matter. Overview of patient safety. Doctor, let's begin at the basics. Many people may hear patient safety and assume it's something hospital already take care of. But in reality, errors, negligence, or systemic gaps still put lives at risk. So how do you define patient safety really in simple terms? How do you define it?
Well, I would say patient safety is a very crucial topic to discuss because across all the stages of healthcare, it's important that the patient's rights are respected, and then also you make sure that you follow the Hippocratic phrase that says, there's a Latin phrase that says primum non nocere, meaning do no harm. First, do no harm. So it's very important that everything a physician wants to do for a patient or plans to do for a patient must be in the patient's best interest and making sure that you are not causing any form of injury or harm, either physically, emotionally, or otherwise to that patient. Because what the patient needs to derive from a physician is timely advice, interpretation of whatever the reports, the clinical reports are, and then instituting the right regimen of treatment for that patient. So the patient doesn't want to come there and go back, in shambles or in a worse state than he met the physician. So it's very important that physicians and all healthcare professionals, now we're not talking only about doctors because it's all encompassing. Yeah. The nurses, the lab scientists, the pharmacists, the diagnostics. So we're talking of people who do the imaging, the x-rays and everything. This applies to everybody, everybody in patient care. Even the admin of the hospital records, all those mentioned, you know, they all must be on top of their game in ensuring that healthcare delivery is done in such a way that the patient gets maximum care and no harm done at all.
Okay. So let's talk about your experience, because I know you're vast in this. You're not just studying medicine today. You didn't just start practicing. So from your experience, what are the most common risks patients face in hospitals or clinics in Nigeria?
Wow, I think this is a very huge question.
Down now. Yes, we're trying to narrow it down.
Yeah, this is a very huge question, because for me, in my experience and from what I have also observed from other practitioners, I see that across all the different stages of care delivery, you know, there are a lot of errors. Yes. There are sometimes oversights. There are sometimes mix-ups. There are sometimes you know, misappropriation of care, let me put it in that way. Because to make it easier for us to understand what I'm trying to describe, let us break it down. So at the doctor-patient interface, where a doctor and a patient meet face-to-face, the doctor, you know, does the history taking, clinical history taking, does the physical examination, would recommend appropriate investigations or tests to support the diagnosis, to arrive at a diagnosis. And of course, he now institutes treatment or management. And in the process of instituting treatment or management, then you have the nursing care, then you have the hospital environment, and then you have those that dispense the medications, the pharmacists and all that. You can have errors across all those different stages. For instance, a patient-doctor interface. If a doctor is not patient enough to be a good listener, to be able to extract information from the patient, to be able to, you know, at least make connections between what the patient is saying, because there are times that the patient is even unclear about what's wrong with them. So the doctor is able to be patient enough to listen and get the right information to arrive at a diagnosis. So if there is a communication gap between the doctor and the patient, then you cannot say that patient is particularly safe, because there's a conflict already going on. There's a gap. There's a communication gap. Okay. So all that, you know, on the part of the professionals, we should be more expressive, improve on our communication skills, be good listeners. Let's not rush through seeing our patients. Let's not look at the number of patients we need to see or the people waiting. Yeah. You know, we need to speed up things. Then, of course, on the other axis, the lab, you know, in diagnostics, sometimes we have issues, you know, with wrong results and misdiagnosis.
Oh, okay. Just a little bit to just buttress this point. Why do you think patient safety is still a major global concern? Because even when I said Nigeria, I knew it's something cut across all spheres, all climes, right? Why do you think patient safety is still a major global concern, despite all the advances in medicine? Because it's not how it is now that it was years before. So why do you think it's a major concern?
For me, I would think the most important answer to that question would be the scarcity of health practitioners compared to the general population. So there's still overworking of doctors. There's a strain, you know, on the workforce of healthcare workers. So you have fewer healthcare practitioners to service a large multitude of people. So therefore, you have people being stretched, overstretched, working long hours, and then you don't pay attention to details. There's so much of work pressure, and then of course, you're prone to errors, you're prone to mistakes, because you need the workforce of healthcare professionals to be better so that it will maintain the efficiency and the standards you need. Because anybody who is overworked, of course, errors are inevitable in terms of records, in terms of dispensing of medications, in terms of nursing care, in terms of even doctor-patient relationship. You know, the doctors get exhausted. Burnout in medical practice is a real phenomenon, and it's a global phenomenon. That's why you have doctors being overworked, you have doctors working long hours, and of course, it eventually takes a toll on their productivity.
Okay. Now let's look at child and newborn safety. You know, Since this year's theme actually focuses on newborn and children, let's narrow it down a bit. Talk about children. What makes children and newborn particularly vulnerable to unsafe medical practices?
Well, that would be multiple factors come into play, because first and foremost, it would come from poverty, ignorance, access to care, access to quality care. Because if the parents of that newborn can't afford good hospitals or good health care, even antenatal care, and then, of course, postnatal care, if they just go to a traditional birth attendant or some maternity homes that are not properly equipped, that child is already at a risk. For instance, some children are born premature. If the child is born preterm and is in a facility where all you need to take care of a preterm is available, then, of course, a lot of things will start going wrong. So the safety of that child is already in question. And then, of course, you also have ignorance. You also have societal and cultural beliefs that also influence, what access a child or a newborn can have to quality health care. Then, of course, we cannot underestimate the training of healthcare professionals also. Right. So if the healthcare professionals don't get the proper training and they don't update their training, because you see, medicine and healthcare is dynamic. Nobody knows it all. That's why doctors still go for conferences, they go for update seminars, and then they are able to know how the current trends, we call them best global practices, okay. So how things are improving. We need to change the trends we've had before. We need to improve on the way we do things, yes. Because there are newer ways of doing it and there are better ways of doing things. But when these are healthcare professionals think they know all and they are all in all, and they are not updating themselves, yes. They may still be doing things in the primitive way that poses risk to the consumers of, or at least the patients who eventually are those that are subjected to these services. So they are not getting quality care as they should. So this should go out to all healthcare professionals, doctors, nurses, midwives, and all those who are into healthcare delivery, to make sure that they're on top of their games. They make sure that they update their knowledge, and they go for update courses, they go for seminars and conferences, and are in tune with global health best practices, so that whatever they do, they're sure that they're giving their patients the premium care the patient should get at that level of care that they're practicing.
Okay. Yeah. Okay. Doctor, recently, still talking about newborn and children. Recently, there's a video that went viral. I don't know if you saw it. A particular woman was pregnant. I think she was even in bed pants. And she went to the hospital and they couldn't deliver her child because she was supposed to bring a certain amount of money, which she wasn't able to. Now let's look at it in context. In Nigeria and across Africa, how serious is the problem of medical errors or preventable harm in pediatrics? Because later on, by the time someone came and helped her get to a hospital and was able to, just a stranger who saw her and who saw the difficulty she was having in walking and have, you would know a pregnant woman, and someone who is also observant will know what this woman is in bed pants. By the time they got to a hospital, that another hospital that she was able to pay, the person paid, the Good Samaritan paid. And the babies to be delivered, the twins died. They were actually twins. And they all died because of I believe, is errors from the medical line. It's what should be done. I don't know how to re-ask this question. In Nigeria and across Africa, everywhere, that this could be applicable. How serious is the problem of medical errors, preventable harm in pediatrics? Well,
for me, I would quickly want to say that anybody who attempts to venture into healthcare in the first instance must have a flair for it. You were not forced to work in healthcare. So you should love people, you should be passionate about what you're doing, and you should have natural inclination for what you do. Because if you're passionate about what you do, you would not need anybody to tell you what to do, because it's just part of you, and that's what you've always done, and that's what you enjoy doing. So you must first and foremost know that that person that you see in front of you as a patient is somebody's relative, is a loved one to somebody. There are a lot of dependents that are on that person. If anything goes wrong with that person, many lives will be affected. So healthcare practitioners should do more about empathy, because it's one of the key ethics of our profession. So make sure that we can really empathize and we can feel another person's pain. And that should drive us into action. And secondly, we should also try as much as possible to pay attention to details as healthcare practitioners, because negligence is deadly in healthcare. A simple error, a simple mistake, a person's life is gone. Misdiagnosis, wrong treatments, administration of wrong doses of drugs, or reporting a particular lab investigation wrongly, either in form of blood work or imaging or whatever, can mean a completely different management for the patient. And like I've always said, you know, a wrong investigation report can never bring up, you know, the right treatment, because you can veer off your physician off the course of the right management, because he's thinking of one thing, he has sent for investigation, a wrong report comes in, and then it changes or alters his whole perspective of the case. So it's very important that everybody across all the stages of care, either in diagnostics, either in nursing care, either as doctors, either as pharmacists, everybody must make sure that they work with a good conscience and with empathy, knowing that that person in front of them is a human being. And our ethics says, you know, respect human life, even from the moment of conception. Yeah. So right from the moment of conception, you are sure that that human being that is growing in the mother is an individual and has a right. So you, and part of your ethics is to protect the rights of even an unborn child. Okay. So when, by the time a child is even born, then that means that your care should even be higher than what it was while the child was in the womb. Yeah. So it's very important that we pay attention to details and we work with a good conscience.
Okay, now still talking newborn, what should parents know? Because you just spoke what medical professionals should know. What should parents know, and how can they advocate for their child's safety when seeking healthcare? How can they advocate for their child's safety when seeking for
So I think that parents, both parents now, you know, should also be actively involved in healthcare, because this is your child, and your child is most important to you first and foremost. So you take your child to the hospital, you should be actively involved in everything that is done for your child. When your child is with the doctor, especially for pediatrics, they are less expressive. So they need an adult who would be the informant, who will be at that doctor-patient interface. Yeah. So you are able to pick up on everything the doctor is saying, ask the relevant questions about your child, have a full understanding on what the doctor's plan or line of management is going to be, and then ultimately follow up closely on everything that is done for your child. So if your child is to be going for some investigations, make sure you follow up on the reports, make sure you have a good and thorough explanation from the doctor on what the problem is and what the line of treatments would be. And make sure that even when prescriptions are given, if you need to reconfirm or you need to clarify anything that isn't clear, it is your responsibility to do that, because your child depends on your decisions.
Okay, thank you so much, Doctor, for that. For those thoughts, insightful words. We'll take a quick break now. When we return, we'll share a special report prepared by my producer, Praise Peters, on World Patient Day, World Patient Safety Day, capturing the urgency of this issue. Don't go anywhere.
What happens in the hush behind hangar doors? Who signs the papers that gamble with lives? Which truths were grounded before they even ever had wings? If you've ever buckled a seatbelt at 30,000 feet, if you've ever stared out of that tiny window and wondered who's really in control of the skies, it isn't just flight, it's power, it's politics, it's pressure sealed in steel. We're peeling back the clouds from runway risks to sky-high secrets. We're diving deep where most dare not to look. Aviation Scope, every Sunday at 7 p.m. only on Voice of the People TV. We don't just report, we reveal. We don't just ask, we uncover. Because when it comes to the skies, ignorance is turbulence. Aviation Scope, the sky isn't the limit, it's just the beginning.
Health is a state of complete physical, mental, and social well-being of an individual. It's the fundamental right of everyone to enjoy the highest attainable standard of health without distinction of race, religion, or political belief. On VOP TV, we bring you Health Check, a show that x-rays different health issues and provides solutions with the help of experts in the medical field. Join us every Saturday, 2 p.m. on Health Check. Health Check on VOP TV. Your health, our priority.
We encourage you to click on the like button and subscribe to our YouTube channel. We are Voice of the People TV. Also follow us on all our social media platforms. We are at VOP TV Live. Visit our website www.vop.ng for fresh and trending news. Also watch us live on SLTV channel 264. VOP TV, Voice of the People Television.
More perspective on this important day and what it means globally and locally. Here is Praise Peters with a special report on World Patient Safety Day.
The world unites to observe World Patient Safety Day today, an initiative of the United Nations and the World Health Organization. This year's theme, Safe Care for Every Newborn and Every Child, draws attention to the urgent need to protect the most vulnerable patients, which are the infants and the young children, from preventable harm in healthcare settings. Every year, millions of children face risks that can be avoided with proper care, from infections caused by unsafe medical practices to complications during delivery or inadequate neonatal support. These challenges highlights the importance of prioritizing patient safety at all levels of healthcare. Health experts stress that safety for newborns and children goes beyond treatment. It includes preventive actions such as clean birthing environments, timely immunizations, safe administration of medicines, adequate nutrition, and early detection of illnesses. Strengthening healthcare systems, providing continuous training for workers, and investing in child-friendly equipment are key to saving lives.
Patient safety is critical, especially for newborns and children, because of their unique biological, care-related, and psychological vulnerability. Now, what I'm trying to say in essence is that for patients, for babies and children, their communication barriers. You do not know, they're not able to tell you what is actually wrong with them. You just need caregivers to be able to tell their distress mode when they actually need something. And they also need them as higher risks because of their organs and their immature body, their parts, their movement, their kidney, their lungs, and also little mistake can also cause long-term consequences or a long-term impact. Hospitals and clinics can strengthen their safety practices for children by, first of all, staff training. Staff should be updated on how to attend to these patients, to know the medication to give, and always moving with the trend. We also have infection control. There should be vigorous hand washing. Aseptic techniques should be used when attending to the patients. And for babies, we are following medical pediatric charts. I think that should be pediatric medication practices. Yeah. Yeah, following medical pediatric practices to attend to these babies, and also strict patient identification. We can make use of ID band for them, making sure that you're surely knowing that this is the patient to attend to before attending to the patient, double checking calculations before administering medication to the patient based on weights. So these are ways we can actually strengthen our safety towards our patients. It builds a safety culture where everybody and every member working there, every staff is actually looking towards the safety of the patients, avoiding risks, and also outdated medical equipment. When medical equipment, it does not give room for medical errors or low quality procedures done on that patient. So yes, those are the rules it plays, and it keeps skills fresh. You're getting updated with the new trend, the new ways, better, safer ways to attend to the patients and the babies. In my own experience, the little things that little things I think we can do to actually improve patient safety, especially in the hospital environment, is actually we have patient identification, working more on how we be able to identify our patients. If we can use code colors or ID band to be able to identify our patients, involving the families at every step of the way to be there. Whatever is happening, they should be updated. And also, double checking of medications with whoever you're working with to be certain that you are giving the right medication, the right dose, at the right route to the right patients. And also vigorous hand hygiene before getting close to any of the patients. And I think for babies, they're basically supposed to have their own things like stethoscope, thermometer. Those things should just be for them to avoid cross infection. The advice I would give to my colleague and policymaker on World Patient Safety Day is for us to work together to commit to delivering safe care through vigilant practices, proper training, and a system that prevents harm.
As the world marks this day, healthcare professionals, from doctors and nurses to midwives and pediatric specialists, are being called upon to reaffirm their role as guardians of safety for children. Praise Peters for Voice of the People TV.
Thank you, Praise Peters, for that astute report. Truly, patient safety is not just a health issue, it's a human rights issue. Now let's move straight to solutions and systemic change. I still have my doctor here in the building. Doctor, so let's build on that report. We've seen the risk and realities, but let's talk solutions. We often hear about medical errors. You've even highlighted some. What role do proper training, communication, and accountability play in preventing these errors?
I think those are part of the major solutions, because when we talk of training, the basic clinical training or healthcare training a healthcare professional gets, in their development during their career building, is very essential. The quality of training is very, very essential, because when you have a very good foundation, the foundation is not just about the academics. It teaches you to become a very good clinician and develop all the right skills and empathy that you need to deliver your best as a clinician or a healthcare professional. For people who do all sorts of wishy-washy trainings, at the end of the day, it always shows. It always shows, the quality of your training by the quality of what you deliver to your patients. Because when a good doctor sees a patient knows. A patient can see through the quality of care or the service that they receive, and they are able to know that, yes, a good doctor has seen me, or a good nurse has just nursed me or attended to me. You can see it by the composure of the healthcare personnel, by the empathy, by the environment, by the communication skills, by the listening skills, and by the ability to have sharp intuition, and suspicion, a high index of suspicion of something going wrong quickly. Yeah, and they can actually predict, what is likely going to happen, and they're already, implementing proactive steps in curbing complications. Those are the key features of somebody who was properly trained as a healthcare professional. And we cannot overemphasize the need for policies and regulations to enforce accountability, on health workers. Because yes, you are working as a health worker, but you also have a responsibility to make sure that you deliver your best at your job. And if you are found wanting in any way, or there's any form of malpractice, then there should be some form of disciplinary actions or measures taken against you. Okay. And that can vary depending on the severity of the harm caused to the patient. So all these are very key.
Okay. Then again, how important is it to empower patients, take for instance, by encouraging them to ask questions about their treatments? Because you come to a case where sometimes patients are being given some medication, drugs, and when they make to ask, the nurse or I already know what I give you, but is it the right of the patient to know what you're giving? So how important is it to empower patients themselves?
It is very essential for you to know as a patient that when you go to seek health care, it is your right to know everything about your health, because it is your body, and everything you're going to take, you should have a very good knowledge of it. Okay. You don't need to be a healthcare professional to have access to this information. So it is your right to ask. It is your right to ask questions. Anything you are not clear about, you can clarify. Why am I to take this drug? What is this drug intended to do for me? What is the end goal of this treatment? What are the side effects of this treatment? Am I expecting to see anything, while I'm taking these medications? What are the do's and don'ts of this treatment? All these are essential questions that a patient should know. And when you ask your medical professional, they should be able to explain in details to you and to satisfy your curiosity about whatever the issues or whatever inquiries you're making, because it is your health, like I said, and it is your responsibility to know. Nobody can make you consume what you don't know. So it's very essential that you know. And I've noticed in my own experience that when they understand what you're trying to give to them and the reason why you're giving it to them, then compliance isn't a problem. You don't have to force them, because they know they need it and they know why they need it and they know what it is supposed to do for them. So you won't need to push much for them to be on their drugs. So for
a layman out there who is like, okay, so what should I tell them? Because sometimes they go asking, and I have heard people tell me, oh, I was asking them and they said, no, am I a medical doctor? So what should be their response in one sentence? What should be
the response? Is, I need to know, because this is what I'm going to consume. This is my life here.
Okay.
Yeah.
So whenever any medical person, practitioner, or a nurse, or a pharmacist tells you, you don't need to know, you're a medical doctor, you tell them it's your body. You need to know. So moving on, doctor, in your opinion, should Nigeria have stronger patient rights charter or enforceable safety policies in hospitals?
Absolutely. I think that is something necessary for any country, because anywhere there are no laws or regulations, then there is no offense. Anybody is free to do anything. But these policies would ensure that everybody is checked at their level of care delivery, and everybody will be made to be accountable if anything goes wrong, or if anything is found wanting in their line of duty. So this helps everybody to be on top of their game. It's just natural, humans being what we are, regardless of being professionals or not. If we know that we are not properly watched or monitored, everything can go wrong. But when you know that there are consequences for wrong action, and then you have a few scapegoats here and there, maybe some people have lost their licenses, or some people have had their pharmacies shut down, or some people have been made, not to function anymore, then it will be a deterrent to other people, because people would know that now we are really serious to make a change, and that human life is indeed precious. So that's important for us to do.
Okay. Human rights is indeed precious. Please stay with us. We'll go for a very quick break, because when we come back, we will look at how individuals, families, and communities can also be part of promoting patient safety. Please stay with us. Yes, you're welcome back. You're still on Health Check on Voice of the People Television. That's the only place you can get it right now. We're still with the delectable Dr. Charles Adiogu. And Doctor, one might think patient safety is only the hospital's responsibility. But surely I believe I know that the public also has a role to play. I take, for instance, one time I witnessed a boxing sparring, and when one of them was knocked out, everybody was taking selfie instead of trying to rush the guy to the hospital because he had fainted. And eventually, in fact, maybe some other day I'll give the back end of the story. But what can ordinary citizens do to reduce risk, whether it's in home, whether it's in the home, in pharmacy, or when visiting the hospital? I would just shed a bit light on this because when I saw that situation, I just came. I came to do another sport, volleyball or something, and I saw this. It happened, and people gathered and were taking pictures. Some were confused, some were, and immediately I had to ask that we whisk the guy, huge though, to the hospital. By the time we got to the hospital, he was placed on oxygen. He was referred to another hospital. The final analysis, the young man died. You see, that time wasted. So what can ordinary citizens do to reduce risk of
I think at this point, we need to also emphasize the need for emergency response in our country because emergency response is almost non-existent.
I thought the government said it's in existence.
We still have a whole lot to do because if there is an emergency, before an ambulance would surface, before you can get to a health facility, those essential minutes are very crucial minutes that can make or mar the situation. You can imagine somebody who has a heart attack or who has an urgent emergency and needs emergency care. How many people can perform CPR on a patient? How many citizens, have basic first aid trainings? These are things that we should encourage. There should be policies. Even in the school curriculum, this can be, incorporated into the school curriculum for students, for young people, for youth. Even in organizations can also, organize trainings and seminars for their staff, so that they are able to know what to do when there's an emergency, the ability to identify an emergency. What are the basic things you can do on your own without even being a medical professional? While calling for help, at least you are instituting something beneficial to the casualty, and at least you are improving the chances of the person staying alive till help comes. It's very essential that we have these policies in place, and it's also essential that we as a people have a reorientation about emergencies. That is not the time to pick up phones and make selfies, because the selfies are useless if you ask me. And that is not the time for people to just stay there and shake their heads and, just looking at the person in pity. It is time for us to be proactive and to develop life-saving skills. Even in the community, for people who are not as educated and people who are not so exposed, you can still learn these things. We can make these trainings available in the indigenous languages, in the marketplaces, in the churches, in the mosque, in the estates, where people live, so that people know how to do these things. We can have demonstrations, live demonstrations of this. These are basic, productive things that we can do for our people, rather than us spending money on things that are really not adding value to us as a people. So the government should look into this. The Ministry of Health should also look into this, and they should invest more in such quality trainings.
Okay, Charles, many times, this has happened many times. Families accept whatever a health worker says, even when something feels wrong. How can families develop the courage to speak up respectfully but firmly? I take an instance. There was a woman, the case I was about to share with you before we started the show. A woman was on bedpans, and I don't know in what case, when the baby is already protruding, coming out, that the woman will be asked to close her leg. But she was asked to close her leg, but she was like, no, I can't. She could feel her baby in between, the right place where it's supposed to be. And at that point, her mother was just what they ask you, so that they will not, the mother was a bit scared. And when she closed her leg, she could feel the baby went up. So how can families develop the courage to speak up respectfully but firmly when they feel that something is wrong?
Yes, that's very good to ask, and it's important for everybody to know that first and foremost, whoever is the casualty or the patient is your loved one, and you took them to seek health care because you care about them and you want to save their lives. But in the process, if you feel anything is off, if you have the intuition that something is wrong, you should speak up. You should be able to, communicate it. But the manner of communication is also important because you can't be telling an already overwhelmed health worker, something in a very rude manner, or in a very condescending way. Of course, you're not going to get the right response you're expecting because they're already stressed out, they're already overwhelmed with what they're doing. But you can ask, I'm sorry, I need to know about this. This feels off. What do you think about this? Please, can you allay our anxieties about this? We have concerns about this, about that. Can you educate us on or make us understand why this has to be this way? And it is your right to ask. And any good professional...
If you feel something wrong, would you still do it?
If you feel it's something wrong, well, you are not a medical professional, but you should trust their professional judgment.
I mean, in that case of that lady that was asked to close her leg when she was supposed to give birth.
But for that lady, because she's not a medical person, of course she would believe what the healthcare professional is saying. But that is why the training of the healthcare professional is very important. If you are in doubt about what a particular personnel tells you, go higher to somebody who is superior to that personnel you're dealing with and ask. That would be a better way to handle it.
Okay. Finally, doctor, on this one, how do cultural factors like fear of questioning doctors affect patient safety in Nigeria?
I know that happens a whole lot because a lot of people just they sit in front of the doctor and they just keep quiet. They're just absorbing all the information, and there's no it's not a conversation, it's a one-way conversation. So you're not getting information both ways, and at the end of the day they just say, yes doctor, yes doctor, yes doctor, okay doctor, so we have to be back in 3 months, okay doctor. They find it hard to ask for different reasons. Sometimes they think, oh, even if the doctor explains to me, I'm not a doctor, would I understand it? And because our people are not, we don't have a learning culture, and we don't have a reading culture. For a lot of patients I've encountered who are not medical personnel, but who go a long way to, read about their condition, and they have a better knowledge of what they're dealing with, the conversation with the doctor is more productive. The conversation with the doctor is more dynamic, and they can be on the same page as the doctor. And as the doctor is telling you, you are going to run this test, and if this test comes this way, this is what we're going to do for you next. They have a perfect understanding of what it is. So we need to do better on our learning culture. We need to do better on our knowledge acquisition so that whatever the doctor is saying, we can also understand. It won't be all Greek to us. We'll be able to understand and we'll be able to relate and be able to ask relevant questions when we should. And of course, when you study, it does something to your self-esteem. You feel better. You are not feeling too small in front of the doctor. So all that counts.
Oh, okay. Doc, as we wrap up, right, let me ask you this few questions. If you had to give just 3 practical tips that every Nigerian, every African family can follow to protect themselves and their children when seeking healthcare, what would they be?
First and foremost, don't look at the cost, because your health is everything. Health is wealth. So please don't look for cheap options. Go for the best. Look for quality. Quality healthcare delivery, where you find quality facilities, quality equipment, quality personnel. Go for quality. Then secondly, be very, very teachable. Don't argue with your healthcare professionals, especially when you have no clue about it. You trust them enough to go to them. So you must be attentive to the instructions they give you, and you should adhere to it. And don't go off their instructions without them knowing about it. Very key. So first is quality. Second is listening and adherence to advice. Then, of course, thirdly would be that you do always go for follow-up. Follow-up is essential. Don't just get lost in the crowd.
Yes.
Your healthcare requires monitoring all the time, especially for chronic illnesses, long-term illnesses that you have to keep managing over a long period of time. You don't just get lost and the doctor wonders where you are, only for you to come back when there's an emergency. So all those are key. And likewise, it applies to the care of your children as well.
Okay. Doctor, I've said it. Don't go for cheap stuff because your health is important. listen attentively, and follow up. Trust your healthcare worker. Then to the last issue I want to ask you, the last question. You know, we're talking about World Patient Safety Day. We're talking about world patient safety in general. What message would you give healthcare workers themselves on this particular world patient safety?
Well, we should make sure that we are true to our oath of being lifesavers. We should make sure that we are proactive and making sure that we put our patients' interest first. You know, we make sure that everything we do, we work with a good conscience, and we make sure that the ethics of the profession are upheld.
Okay. Thank you so much, Dr. Charles Adiogu. It's always very insightful. Such an astute personality. Patient safety, for me, is not just a hospital issue. It's a community responsibility. It's about a mother who deserves to trust, who needs to trust the midwife holding a baby. It's about the midwife who needs to be tender to the mother who is in bedpans. It's about a father who should fear that a lack of basic hygiene could harm his child. And it's about communities standing together to demand safety, to demand safe, dignified, and quality healthcare. Every safe birth, every safe injection, every safe diagnosis is a step towards a healthier society. A very big thank you to you again, Dr. Charles Adiogu.
Thank you
for your
having
time
me.
and wisdom, because it takes a lot of wisdom, I believe. And one day, some days I'll just come and sleep on your bed, just so that it can just flow, you know.
Thank you so much. Thank you.
And of course, thank you to my astute producer, my one and only. I said I'm not going to share you. Praise Peters for that wonderful report earlier in the show. And to you, our viewers, thank you for joining us. Let's remember this. Healthcare should heal, not harm. Whether as a patient, a parent, or a professional, we all have a role to play in making care safe. Join us again next week on Health Check as we tackle another, trust me, another crucial subject that directly impacts your well-being. Remember, you can follow us across our social media platform. It's Voice of the People TV on YouTube, and across every other social media platform is VOP TV Live. And you can also send me a direct message across all social media, Instagram, Twitter, YouTube. Send a direct message and hashtag Health Check at Pure Chomalina, PURECHIOMALINA at Pure Chomalina for questions, in case you have questions for the doctor, and we will do well to respond to you. Until then, I am Chioma Lena, reminding you to stay informed, stay safe, and stay alive. This is Health Check on Voice of the People Television. And stay in love.